So people ask, what are the pitfalls of incorporating AI into healthcare, and what are the dangers? There's definitely dangers that have come up. They're well documented. There's certain biases. The simple way to explain how AI works is it's basically a mathematical equation. So you throw information into the function as we learned in basic algebra, and then it kicks an output. So depending on what information you put in, and in particular, it's a little step, but where these models are trained on, the information these models are trained on, you may get the incorrect output. And people are very conscious of that. But it's important for practitioners to understand machine learning algorithms and how they work. Because if you don't understand, you can't ask the questions. And one of the big questions is, starting point is, what is the patient population that your model was trained on? And recently, there's been some regulatory laws that have been passed that people who create AI systems must disclose very carefully what their training data was, so that practitioners can say, does that fit with my patient population that I'm using? So there are definitely pitfalls and bias, knowing what the training data is, and improper outputs. And there's a big push to try to eliminate the black box, which is, I ask a question and it throws out an answer, and this black box in the middle where we don't understand how it's working or how it's coming up with information. So those are definitely some pitfalls you need to be aware of when you're utilizing this technology, and that's why you need to slowly educate yourself as a practitioner on these new things that come out, because if you do know how to utilize them, they're so powerful.